Hi, I'm Scott Peterson. I'm a plaintiff's litigation attorney in Saratoga Springs, New York. Today we're talking about a missed cancer diagnosis. In other words, when is a lump not just a lump? Most of us through some point in our life are going to have some kind of growth on our body that raises questions. And typically we would go in to see the doctor. And it's important to remember that when we go see the doctor, we ask the right questions. We ask the doctor to look at or feel the mass, to palpate it. We want to be sure that the doctor takes measurements, makes real observations, instead of just glossing over the condition. In and around the joints, there's something known as a synovial sarcoma. It's a somewhat rare form of cancer that can happen when a lump around a joint typically goes unnoticed. Now, a synovial sarcoma is a slow-growing cancer. It generally doesn't just pop up overnight. So how does it get misdiagnosed? Well, let's say you go to see your orthopedic surgeon about a small mass in your knee. It's just around the joint area of the knee. And your orthopedic surgeon is convinced that it's just a cyst. The surgeon will maybe feel or palpate the mass, maybe take a small measurement. Is that it? Because what the surgeon should be doing is making sure that the lump is not hard, that it's not changing in size, and if necessary, the surgeon should consider aspirating the lump or the mass. If the surgeon does attempt the aspiration, you'll want to be sure that the aspiration is actually successful. This may seem like common sense, but it's something that we've seen. An example that we've seen is where a surgeon attempts to aspirate a mass, gets the needle in, but has trouble because the patient can't tolerate the pain. You see, sarcomas in particular can grow in and around the tendons around the joint, so getting a needle in to aspirate something can be very difficult. Now, of course, there are other ways to get the needle in, including sedation, but in the example that I'm using, that didn't happen. If your surgeon attempts to aspirate a mass and tells you that it was unsuccessful, ask why. Ask if there's anything else that can be done to confirm that there's fluid inside the mass rather than simply a hard growth, which can indicate that the lump is in fact malignant. If all else fails, ask them to take it out. Now, look, orthopedic surgeons and doctors in general don't like to perform aspirations or biopsies or go around removing lumps unnecessarily. Anytime you perform surgery on a patient, it can be difficult and it can present risks. But that doesn't mean you can't be your own advocate. We've seen too many situations where patients simply relied upon the opinions of their doctors, who, for one reason or another, had a preformed opinion and didn't adequately consider what was in front of them. Don't let that happen to you. If you have questions about a mass or a growth that seems abnormal and you feel that your surgeon is not adequately addressing it, get a second opinion. And if you've had the misfortune of having a delayed diagnosis or a late diagnosis after treating for a condition for a period of time, give us a call. We see lots of these cases. We know what to look for, and we know how difficult this can be on a family.